Is the Bronx the new hotspot for COVID-19? District Manager for Community Board 12, George Torres, in responding to a recent report by the New York City Department of Health and Mental Hygiene, says the numbers here speak for themselves. Numbers showing that among the top 15 zip codes showing residents citywide who have tested positive for COVID-19, not only are there 8 in the Bronx, Torres is looking at some challenging news for his district.
The top 3 zip codes in the Bronx that are afflicted by this, 10467, 10469, 10466, which all happen to be here in Community Board 12, there are no testing sites.
This despite the fact that next to Corona Queens at the number 1 spot with 4,054 testing positive, the Bronx's 10467 is second with the Norwood section outside the district, while Olinville is within, coming in at a combined 3,061 cases. Fourth is 10469 with 2,769 cases in Baychester that falls within the district, along with Allerton and Pelham Gardens. In 11th place is 10466 in the Wakefield, Edenwald, and Eastchester sections with 2,174 testing positive.
I think what this virus has done is really expose the inequities that we already knew in this community existed. So the only thing that was very surprising was the city's approach to it.
An approach that has failed to match the urgent care needed for its roughly 157,000 residents, the majority of whom are African and Caribbean American.
When they started rolling out the free giveaway for the mask and for the gloves and stuff like that, they weren't in this district. They did one last week on Thursday, I believe that was the 8th, May 8th, at Haffen Park. That was the first one that they did at the district. And again, I think you should be driven by data. And if you know, especially here in the Bronx, that we are suffering, and minority communities especially are suffering, you should be focusing your efforts on addressing those issues.
He says he was hopeful early on after Montefiore Medical Center set up 3 drive-through testing sites in Bay Plaza Mall, the Bronx Zoo, and Lehman College, but that hope turned to disappointment.
Maybe 2 weeks after that, they said, we're going to start doing testing at Edenwald Housing Development, which is in my district. But again, that was 2 weeks too late, and it was only focused on Edenwald. I mean, we're talking about a much larger district, and I think the concern with many of us in the district is that all the testing sites that they have right now, one, they tell you you have to be symptomatic, you have to have something going on so you can call and make the appointment. But you also have to drive.
The immediate need, he says, is a walk-in clinic, preferably on Westchester Avenue, to make it easy for subway commuters on their way home.
I have 2 end-of-line trains here. I have the number 2 train, which ends on 241st Street, and then I have the Dyer Avenue number 5 train that ends on Dyer Avenue. So we have these situations where our constituents, my constituents, are forced to take the train and public transportation to get to locations. And I've heard from one too many people like, I can't go to Co-op City because they're only doing drive-through testing, or I can't go to Lehman College because they're doing drive-through testing.
He also wants to address the poor food options in a community with a large amount of bodegas and fast food eateries and too few fresh food markets. We reached out to the city to find out about testing sites in Community Board 12 and are waiting to hear back. For BronxNet, this is Arlene Mukoko.